Yeah.
You know, I went into it. You know you're gonna wake up and you're not gonna have this limb.
Mhm.
You know, you're under the blanket when you first wake up, so that first look is like, you know,
Traumatic, a little
Mhm.
traumatic.
like a punch to the gut, and
Yeah.
you know, but it's really truly you know. I remember telling myself before I went under anesthesia, you know, you're gonna wake up and you're not gonna have a leg. And you know, it kind of, you know, they said to tell yourself beforehand because when you wake up, you know, some people get nervous, whatever. You know, so it actually kind of flowed very easily for me. But before this even happened, I hadn't walked for a year of my life. Was spent in a recliner, zero mobility. I lost all. I had atrophy to everything. I hadn't moved. I was on crutches. I was, you know, there was nothing going on. And I ended up with this whole thing because I have CRPS, which is a pain disorder. And I opened a nonprofit for this because there's a lot
Mhm.
of people who suffer from CRPS. And it had a name called RSD originally, which was regional sympathetic dystrophy. Then they changed it to chronic. You know, they changed it around.
So it's a pain
Mhm.
disorder. I'm not familiar with it. So what exactly do you feel, or what is it?
It's called chronic regional pain syndrome, and it's from a nerve damage. People can get it from, you know, staph infections. You can get it from slamming. I mean, something as simple as slamming a toe, like stubbing your toe. And it's been around since the Civil War, but it affects your sympathetic nerve system,
Mhm.
and it, you know, affects the way you sweat, affects the way, you know, your skin is red. You get burns. You get a lot of, you lose feeling. So I haven't had feeling in my hands in like years. So I had an incident where I went for a pedicure and got a second-degree burn because I couldn't feel how hot the water was.
Ooh.
Wow.
You know, and I didn't realize this was going on. So as it was happening, it was like these weird things were happening. And I ended up getting this from a surgery that, you know, the nerve was touched and that was it. And it spread everywhere.
Wow.
So it's a
What,
disease.
if you're okay, what type of surgery was it?
It was an ankle surgery. So before I lost this ankle, I had a surgeon leave a tool inside of my foot years ago when I had just graduated high school.
Oh. You th
Wait a minute.
Yeah, yeah, yeah.
Wait a minute. How big was said tool?
The tip of a vaporizer. It was the first time they used the
Mm.
instrument. And it broke off. And instead of keeping me under anesthesia longer to remove it, they just decided to leave it in there.
That's
Stop.
insane.
Yeah, so it rolled around for 6 months or so. I went to the hospital and they were like, "Ma'am, you know you have a piece of something in your foot."
So you felt it in there,
I
or
felt pain. You know, I had pain. I
Mm.
just had pain for like, oh my God, what the hell's going on? You know, I felt like I had an infection, you know, and then they were like, "You have metal inside of you. Is it supposed to be there?" And I was like, no.
no, not
No.
unless
Not to my knowledge.
not unless the aliens abducted me
Yes,
and left it
no,
in there.
not to my knowledge. So, you know, that was the start of I had 30 something ankle surgeries.
Wow.
Jeez.
And in between that, you know, the more they cut you, the more your nerves get damaged, and this
Mhm.
disease kind of crept in. And it just takes over your life. You know, it's rated, you know, there's a McGill scale. I don't know, it's a pain scale, and it's rated as if you amputated a limb at home by yourself. It's the highest on the
Mm.
pain scale of
So it
any disease.
so it causes pain, but it also numbs senses so you can't feel pain.
Some people have, like for me, I have a lot of numbness, so I don't feel it. But for some people, just like the wind touching their skin is enough to bring them over the edge. And you know, it really water touching you, cold touching you can spread these things. It's a very rapid disease. It happens very quickly, and you really know people don't know about it. So
Mhm.
it's one of those rare diseases that comes out of nowhere, and now people are slowly starting to hear about it. You know, a lot more people are being diagnosed. You know, so I opened a nonprofit for this because I'll go to a hospital. You know, I was going and I'm like, I'm having so much pain, and they're like, "We've never heard of this disease."
That's reassuring.
They're
Yeah,
just like,
really.
so they say, "Let me Google it really quick," and they'll bring up, you know, chronic regional pain syndrome. And they're like, "Oh my God, we've never heard of it." Well, if I'm here at the hospital and you're the doctor and you've never heard of it, how are you supposed to help me?
Yeah.
It's the same doctor that left something in your foot and said it's good enough.
Exactly. This is fine. We'll leave it there.
Yeah.
You know, so 30 surgeries down the road, you know, I had broken my talus inside of my ankle, which is, you know, a joint that's not a hinge joint. It sits, it floats.
Mhm.
You know, and I had a doctor say, we're going to do a 3D talus replacement. It's going to be amazing. You're going to come out of this. Things are going to be great. Needless to say, I had it put in. I had it in for 28 weeks of zero movement at all. And it flipped.
Ooh.
It was not sitting correct.
Nice.
Yeah.
We went in again. We tightened ligaments. We tightened tendons. We, you know, did all this crazy stuff to try to 8 more weeks, and it flipped. By that time, the foot was was done. There's no more movement. There's no pulse on top. There's no pulse on the side. Now the only option is this. So what do you do when you're faced in this situation? And I get this question a lot. How do you make this decision? And, my answer is, how bad do you want to go back to your life? How bad do you want to have some kind of normalcy? I'm not saying, they said when you cut it off, did the CRPS go away? No. I have it. It is what it is. But it's really how you face these things. How are you going to face this problem? Yeah, you're in pain all the time. But are you going to lay in bed and cry about it? And people
Right.
say, oh, you're not being sympathetic. I am. I'm being very sympathetic, but I'm being honest.
But you're also not gonna lay there like a wounded dog and just
Mhm.
You know what? The more and movement really helps. So for me, I'm in a place where my opinion is you cut the limb off. If you are a person who has CRPS right now and you have it in one limb and you can't move that limb at all, you're hostage to that situation. Now you're a hostage. I don't care if it's an arm, a leg. If 50 chance that you're going to come out of this and that pain's going to be gone, if you can't use it already, what's the difference?
yeah.
You know
It's a
what?
hazard.
It's a hazard. You're constantly, you're like this, you're protecting it, you're forever shielding yourself from getting touched. You know what? Doctors will argue with me that, this is not correct. Once you cut it off, it has the ability to spread. It has the ability to do that anyway, but this can also be a situation where it has the ability to end the problem.